Good morning, guys. Tony Maritato here again. I had another great question come in from the Facebook group, the Total Knee Replacement Support Group for Kind People. And this was from an individual who has a dog who lives alone and wanted to make sure that there was nothing he can do after surgery, or nothing that should be done after surgery, to reduce the chances of infection, because his dog is just one of those lovey dogs that's going to stay by his side the whole time. While full disclosure, I am not an infectious disease expert, but we do deal with and manage incision and wound care as physical therapists. I can tell you that if you have been a pet owner for any length of time, your body, your immune system, everything is kind of acclimated to your animal. So simply having the dog around, having the dog available, probably does not increase your risk of any kind of infectious disease or problems related to the normal healing process. Like anything, you're going to keep either the dressing that's on your incision, you're going to keep that clean and intact. In some cases, if the surgeon uses staples or chooses not to cover the incision, certainly you're going to do your best to avoid getting any kind of debris or dog hair or things like that on the incision itself. But the same rules, the same guidelines would apply whether you have a dog, don't have a dog. You just want to do your best to maintain the hygiene around the incision, keep it clean, keep it dry. If you see any early signs of infection, any redness, any drainage, any sense of odor around the incision, you would want to get that monitored either by your physical therapist or by the surgeon. But if you let your surgeon know ahead of time that you have a dog that's going to be by your side, or we have a lot of patients that have cats that like to climb on them, sit on their lap, it's one of those things that they might use a different kind of dressing based on that information. So talk to your surgeon, but don't stress out. You should be fine in most cases.